EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. It's my pleasure to be here every week with wonderful guests that teach me and everyone else, I hope, a little bit more about the wonderful community resources that we have and the wonderful people that make those resources work. So today is no exception. I'm very pleased to have Judy Cruz here from the Treasure Coast Food Bank. This is, one of those things that as I'm driving into the parking lot, it's like, how am I going to intro this person today? And from the things that I've seen you do, and I know there's a lot more that we're going to talk about today, it brought back that connection between health and food. An apple a day keeps the doctor away. Mm-hmm. And boy, wouldn't that be wonderful if we didn't have to do that kind of worrisome thing. But nutrition is certainly a huge part of health.
It really is. And it's a huge part of what Treasure Coast Food Bank does. It's a focus for us. We can feed people, give them food for today, but the goal is really to provide that holistic approach to providing food assistance. We can put food on a table, but there's a lot of things that happen when food isn't on a table.
Absolutely. We see diabetics who have to have a special diet. A lot of people struggle with blood pressure. Mm-hmm. And, it's got to be more than just handing out pills and medicine. It's
Exactly.
really a way of life. The prevention, another one, an ounce of prevention's worth a pound of cures. So, again, trying to install that education of lifestyle choices. Mm-hmm. And, we all want to be spoiled. I'd like nothing better than to eat chocolate all day long, but then I'd be as white as I am tall, and that probably wouldn't work for my health. So,
no.
A little self-discipline goes a long way.
Absolutely. And knowing how to incorporate those sweet treats and things into your daily diet is critical. We've been really lucky over the years to have access to wonderfully fresh produce and lots of different vegetables and things that are grown right here in Florida. So we've been pulling on our Florida natural resources and using that in different programs to educate people about healthy eating, dietary requirements if they have certain health conditions, and then what does that look like? And when can you cheat a little bit on adding that chocolate?
We all like to cheat
yes,
a little bit.
Yes, we do. I cheated last night. I had a slice of lemon pound cake, which I enjoyed very much, yes. But I stopped at one slice.
Yeah.
So,
and that's the secret.
Exactly.
Exactly. Moderation.
It is.
So I've seen your trucks out coming to where people are. Mm-hmm. I confess I have not been to your main location, which serves 4 counties?
That's right. Yes.
Okay.
We work in Indian River, Martin, St. Lucie, and Okeechobee counties. And we work with about 250,000 people each week that are food insecure. And it's a staggering number. It's a number that's hard to wrap your mind around. But there are so many people that are really having difficulty making ends meet. And with the uncertainty right now, the economy and cost of living and insurance and all the things that we're all struggling with, people that are having difficulties with their budget are also having difficulties putting food on their table.
Yeah, because you can't make a partial car payment for very long and get away with it, but you can trim back your grocery budget.
Exactly.
I was following behind someone the other day, and they were on the phone, and they were like, look, I can't afford this kind of car insurance because my food budget is already down to $65 for the 6 of us a week. And I was just like, oh my gosh, $65 for 6 people.
I know it's. I don't know how people do it. And food is where they sacrifice. That's usually the easiest thing for people to give up, or they'll find those empty calories, and that's where those health problems come in later in life, or even for children. There's issues with childhood obesity, learning disabilities that come along with that, behavioral problems because they're eating empty calories and things that aren't good for them. So what we're trying to do really is go to people where they are. There isn't one way to solve hunger. We do it with our network of 300 agency partners that we work with. And we also do it through the many different programs that we offer, through education, through direct service, our mobile pantry distributions, and we work with you with that. And our Market Fresh truck is at the Fellsmere location. So we're able to go into neighborhoods, go right where the folks are, and along with that, provide recipes and counseling and outreach assistance to different programs that people might be in need of. And then we have registered dietitians on staff and case managers that help, so we can stay with a family for as long as they need it.
So let's start with the basics, because I'm sure that I'm not the only one that said, oh my gosh, $8 a dozen for eggs. How do people manage? So how can we help them manage? First off, where's your stationary location?
So we're located in Fort Pierce, off of Angle Road, right off of 95 and the Turnpike. Okay. And then we have another office that is located in Martin County for case management. And we have another case management location closer here between St. Lucie and Indian River counties. But our folks are on the road. The case management team is on the road every day, meeting at different locations throughout all the 4 counties.
And when I think about case management, I think about individuals like our nursing staff that talk to patients about their healthcare journey and ways that we can help them. I'm assuming your case managers are doing the same thing, but with more of a food twist.
With food and with other needs that they may have. Okay. So we'll connect them with other community resources if they need help with tutoring for their child, if they have an older family member and they might be struggling with that. A senior family member will help them get the services that they need. So
anything that's on the periphery of food management and families.
Well, what we're trying to do is a one-stop shop for people. If they're already having trouble, rather than have them take off work today and tomorrow and another day, while they're with us, we want to see what else can we do to help them. So it's a holistic approach to providing food assistance, but food assistance is a piece of that puzzle, right? It's a piece of the pie. And there's so many other services that are needed typically when somebody is food insecure. So while they're with us to solve a food resource problem, we try and make it as easy as possible to provide the other services that they need, or the information and connection, and making sure that we follow up with them so that they're doing what they need to do, like a parent, with their children.
Well, and as we said earlier, before we got on the show, sometimes those in the teens and 20s, they don't know what they don't know. So when they reach an obstacle, they don't know how to press on through that. And so we can give referrals, but if something happens in the course of that referral that they don't know how to handle, or they don't get callbacks, they just kind of throw up their hands and and need that guidance again.
There's so many things that are a struggle for people, and when you have issues that you're not sure where you need to go or what you need to do, it's compounded and it feels like it's almost insurmountable. Exactly. So that's where the team helps in that way.
And you said they're often on the road, so I'm assuming that by going online to stophunger.org.
Yes.
Okay, I got it. Stophunger.org. Is the place to go online, and then they could maybe connect up with a case manager that way?
Yes. Yep. Okay. They can fill out a referral there and get
have
connected.
A private conversation.
Yes, everything is confidential. We respect people's privacy. We're bound by HIPAA, all the things that a typical organization is, like a health organization. So we're fortunate that we're able to do this work. We're fortunate that we're able to expand it into nutrition education, medically tailored meals, working with insurance providers, helping with patients getting the specific food types that they need based on their diagnosis.
So the old days of wandering into a warehouse and picking 6 cans off the shelf has really been enhanced.
Yes, it's not our grandparents' food bank, that's for sure.
Okay, I'm showing my age.
It's morphed. I'm showing it too. It's changed. I've been with the organization for 15 years, and it's changed tremendously in that time. We had to. Giving people food for today, like I shared earlier, is something that we will never stop doing. But we have to put in the resources and the solutions to create sustainability for people.
Right.
And this is some of the ways that we do that through our case management, nutrition education, job training programs. All these things are areas that over time we discovered people were really having issues with and struggling. So if we're able to overcome some of those challenges for folks, it makes it
I'm
a
so
success.
impressed. I really am, because it's a tough job when you're talking about taking care of as many people as you are. Just the warehouse factor alone, getting food in, getting it to the right place, getting people to access it. I mean, that's a Herculean job to start with, and now you've got all of these other components.
Yeah.
So kudos.
It's a lot of things happening under that roof.
I can tell. So do you have a lot of employees, or a mix of employees and
We have
volunteers?
96 employees, and then we work with interns. We work with Vista volunteers, and then we have 14,000 volunteers that work with the organization. Last year, we logged, I think, almost 50,000 volunteer hours, and it's critical. We can't do it without our volunteers, and our volunteers show up in all different ways. They work in the warehouse. They ride with the Market Fresh trucks and the mobile pantries, and they do community direct service. They help counsel if they have a background in that. A lot of retirees have relocated to Florida, so we're fortunate that we have a good handful of folks that have a background in medical background. And they're able to support our team. We have a small but mighty team. Yeah. So it's great. It's a great way for people if they have time to get involved, not just with Treasure Coast Food Bank, but all the nonprofits in the area need help. And if a couple of hours a week you're able to give, it makes a difference in any organization.
Without a doubt, but particularly with the huge needs that I hear here, and pretty much a central location to our listening audience locale between the 4 counties. It would be great. And again, I'm guessing that's on your website?
Yes, it is. Okay. Everything is on the website, stophunger.org. You can learn how to volunteer. If you need food assistance, it's there. If you want to just learn more about the organization or other organizations in the area, there's links to everything there.
Very nice.
Yeah.
Well, we're going to take a short break for a word from our sponsors. And when we come back, we'll talk a little bit more about the specifics of some of those programs. How's that?
Wonderful. Thank you.
Okay. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Create your island paradise at Sunshine Furniture during our winter sale event. Save 50% on all Tommy Bahama and Lexington, including the newest collection, Key Biscayne. Living room, dining room, occasional chairs, office, and media furniture with sophisticated design and a mix of coastal and Caribbean style. All Tommy Bahama and Lexington offer everything you need for your Florida living. We have the largest selection of in-stock coastal furniture from Four Seasons, Capri, Universal, Riverside, Hooker, Seawinds, Barca Lounger, Best, and lots more. At Sunshine Furniture, we're the outdoor furniture experts specializing in patio sets that withstand the Florida elements, and we have a gallery of Berlin Garden and Pollywood. Come in now for the best prices of the year. Sunshine Furniture, $12.95 US 1 in Vero Beach. Don't miss the 50% off winter sale on Tommy Bahama and Lexington going on now. Visit our website at sunshinefurniturecasual.com and visit our outlet store directly across the street.
Get stoked, bro. It's the Downtown Beach Bash presented by GHO Homes. Catch the wave of fun and ride it all the way to downtown Vero Beach with live music by Riptide, plus kids games, beer, food trucks, and prizes. We're not hanging 10, bro. We're hanging from 6 to 9 p.m. Admission is free. Sponsored by GHO Homes, Sandpiper Pest Control, and Millennium Cremation Service. The Downtown Beach Bash, a Main Street Vero Beach event. Friday, March 28th, 6 p.m. Downtown Vero Beach.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule, and I'm the CEO of Treasure Coast Community Health, where we provide primary care services of all kind. We try to make it as convenient, accessible, high quality. So if you haven't tried us yet and you're looking for a primary care doc, dentist, behavioral health specialist, or pharmacy, consider coming to us. A lot of folks have said that they think we're only for people that don't have insurance or don't have a regular job, and we certainly take care of all of those folks with a sliding fee scale or through generous donations. But the reality is we are healthcare for all, and so if you have Medicare, if you have Blue Cross, if you have any kind of insurance, including Medicaid, we'll be happy to work with you. And I can assure you our staff are the finest. And you're not taking anyone's place away in planning for our expansion, both out west and in Oslo proper. We have added staff, and so we have the capacity to get you in within days, if not a few short weeks. So give us a call. Prevention is the key. Today we're talking about food and nutrition with Judy Cruz from the Treasure Coast Food Bank. But it is a thing that goes hand in hand in terms of having good health and good food and nutrition, the right balance between proteins and carbs and those little treats that we just say, well, it's brown and so it must be good, right? Like meat, but it's chocolate. Yeah, there's my theme song. I'm a chocolate hound and I do have to watch it. But you have a number of things going now, and like us, you are expanding.
We are. We are. After COVID, it's been like a whirlwind. We realized that we weren't able to keep up with capacity in the facilities that we were operating out of. We're in 3 facilities spread out in the county, and it's not efficient. So last year we broke ground in February on a 132,000 square foot warehouse.
That's a big warehouse.
An operations center, yes. So we were kind of in our silent phase, and now we're public. So it's been a public silent phase because everybody kind of knew about it. But it's an opportunity for us to bring our operations under one roof, realign efficiency in the organization, and really be able to strengthen our outreach and fill in the gaps where they are. We have a really robust production kitchen, and that will be rolling into that facility as well. And we'll be able to do some expansion there with regard to our medically tailored meals program and our prepared meals that we provide to after school programs and senior programs.
I had no idea.
Yeah, these are things that we have done, but we couldn't really expand too much because we just didn't have the capacity. We do about 6,000 prepared meals a day right now, and we'll be able to ramp that up, double that, within a few months. Yeah. So we're really, the facility was built with all of this in mind, with our training programs, our teaching kitchen for the culinary program, but also job training in logistics and CDL, and then working in healthcare with folks that want to go down into that field of social work and then nutrition education.
Wow.
Yeah, so it's, we're food again is our main mission, our core mission, but all of these ancillary programs are wraparound services that fit nicely with what we do. And it's an opportunity for us to really offer economic impact and a trickle-up effect for the community by providing additional resources out there.
I was going to say we could be sisters from different mothers, but I think we'd have to share the same mother because our philosophies are so similar.
Yes.
The only difference that I see is you're following the straight MBA. To be efficient, you put everything you can under one roof. We tried that, but the reality is that healthcare is probably more frequent a need than the once a week or once every couple of weeks food collection. And so we have gone across multiple locations to try to make it easier for folks.
Well, and Vicki, for us, when we meet with our constituents and our investors in the organization, we'll be in Martin County, let's say, and they don't understand why we don't have a physical building. We do. We're there. We roll in there every single day. We have tractor trailers and straight trucks that go and do deliveries to our partner agencies. They set up for mobile distribution. So we're in every community in every county every single day. And we're just on wheels.
That's the joy of nonprofits, though. You can be flexible. You can change things up.
Yeah.
You explain it. You ask for new ideas. You pursue different things. And
it's great. It really is. And, we have a wonderful support from organizations like yours. Our goal is to really bring everybody together and work as efficiently as possible because there's limited resources.
Absolutely.
And with what's happening, across the country, there's only so many dollars that can go around.
We're all so worried about what's happening. Change is hard in the best of circumstances.
It is.
And not understanding how tomorrow's going to affect your budget, which then affects not just health, but as you say, food and other things of logistics nature. It's I mean, difficult. The farmers are our lifeline, and we are behind our farmers 100%. And there's a lot of giant corporate farms that can withstand these types of fluctuations, that are happening. But there's so many small family farms in Florida, and that's who we work with. That's who we have our relationships with, and that's who we want to support and make sure that they continue to grow. We have plenty of new home communities here, and we need those. We do.
But we also need our farmers.
Yes, we absolutely need them.
We value them. So our goal is to continue, supporting them in any way that we can.
So do you have a wish list? We've got a minute and a half left.
Oh, we need furniture. We don't have any furniture. We need furniture.
I wouldn't have expected that.
We need furniture. We need warehouse racking.
Okay.
We need a couple of 5-pallet high forklifts and some things like that because we're going from 3 buildings that total 60,000 square feet into one giant, very tall warehouse that we can't reach to, our forklifts right now can't reach to the top. But
so there you got it. It's not your usual wish list, but certainly an important one. And if anyone can help out on Treasure Coast Food Bank, you know that it's going to be a return on investment of 100-fold, maybe 1,000-fold with the number of people that you serve.
Yes.
Thank you so much for coming today.
Thank you. I appreciate your time and allowing me to share our story.
Well, it's quite the story. Kind of like the candle under the bushel basket, but I'm sure that will change as your development gets closer to opening, which is in early fall.
We're looking at moving in sometime in July, and then we'll have a grand opening after we feel out the building and get our, our feet wet in there and not get lost.
So we're having that same problem with our west location. It seemed perfect. It will be perfect, but right now it's 3 very long hallways, and we're like,
you're trying to plan it out. So we're going to live in it for a little bit, and then probably in October we'll have a big grand opening, and everybody's invited.
And all of your locations will be open until then?
Yes, absolutely.
Okay. Very good.
Yeah.
So again, stophunger.org. Take a look at it. There's lots of great resources. And if you don't need them, you probably have a relative or a friend or a neighbor who does. So take a minute to educate yourself on this. And if you can do anything to help, please do. And again, have a great afternoon, and we'll be back next week.